Is your back pain due to your kidneys? Stay tuned to find out. Thanks so much for watching. Make sure you subscribe to my channel, share my video, like, hit that bell so you never miss a new recipe or a new health tip. I'm Dr. Blake. I'm a board certified kidney doctor, nephrologist, and I'm also the cooking doc. And today I'm going to share something with you that I often get as a question from people who I see in my office. There are a number of different ways that this question gets presented to me in the office. Oftentimes it comes in the form of, well, how can I have kidney disease? I never have kidney pain. Great question. Other times it comes in the form of, well, you know, doc, I'm not surprised I have kidney disease because I often have this back pain. Do you think that's the cause of it? Again, great question. It makes sense for us to think that pain in the back is related to your kidneys. But for most of you out there, it is actually not. So when people come to see me in the office, they come with what's called chronic kidney disease. And chronic kidney disease is a disease that describes kidneys that don't filter perfectly. And chronic kidney disease causes no pain. So you can have chronic kidney disease and not have any pain in your kidneys, or you can have chronic kidney disease and have back pain, but that back pain is almost certainly not related to your kidneys. Now first, let's talk about where people have back pain and where your kidneys are. So your kidneys are up high here under your rib cage. Most people, when they have back pain, have it way down here in the low back. Low back pain is almost certainly not caused by problems in the kidneys. Now there are a few exceptions to this whole story. So there are things that are associated with kidney disease that cause pain in the kidneys. So kidneys can cause pain. There are nerves around the kidneys. And so the question is, what things in the kidneys actually cause pain? Review this: chronic kidney disease, no kidney pain. All right, got that out of the way. Things that cause kidney pain include kidney stones. So if you have kidney stones, you're going to have some kidney pain, and it is almost certainly not going to be subtle. Next, people who have polycystic kidney disease often have cysts in their kidneys that get infected or bleed or rupture, and those things can be very painful. So polycystic kidney disease does often come with some kidney pain. And for those of you out there suffering through pain in your kidneys from those things, I sympathize with you, as I know it can be incredibly debilitating. The last thing that can sometimes cause kidney pain is something called pyelonephritis. This is an infection inside the kidneys. You hear about urinary tract and bladder infections. Well, this is something that goes all the way up and causes a kidney infection. Kidney infections can cause kidney pain, but they are not related usually to how well your kidneys are actually filtering. So the bottom line is that your kidneys can certainly cause pain, but kidney pain has nothing to do with how well your kidneys are actually filtering or a diagnosis of chronic kidney disease. Most back pain is caused by musculoskeletal issues and can be debilitating, but almost certainly, in most cases, it's not related to your kidneys. Thanks so much for watching. I'm Dr. Blake, the cooking doc. Make sure you subscribe to my channel, share this video, like it. Check out my website, thecookingdoc.co. Buy my book if you like this kind of thing, The Cooking Doc's Kidney Healthy Cooking, a Modern 10-Step Guide to Preventing and Managing Kidney Disease. And we will see you next time.